Hey friends, Michael, licensed physio, total physical therapy. Listen, I get a lot of repeated questions around lower back pain and degenerative disc disease, and I felt like there was no better way to answer and to squash a lot of those myths than to invite one of our own resident frequent flyers into the clinic. Today we've got Metal Mike joining us. He is one of our most eccentric and enthusiastic individuals around the subject matter, and he's willing to boldly go where most people shy. So without further ado, I welcome Metal Mike and open the floor to any and all questions.
Yo, Mike, thanks for taking me on. Other than you, the only other people I know giving these kind of answers are those hippies out in Silicon Valley. So I'm just trusting you to shoot me straight. All right, M-Doc, shoot me straight. I got wind that rest is ultimately the best treatment for lower back pain. I mean, when my back gets reared up and flared on me, there's nothing I would rather do than call my boss and let him know I'm laid up. I mean, ultimately, it gives me that opportunity to get on Netflix and catch up on my episodes of Golden Girls and Stranger Things.
Well, I can appreciate one's desire to rest following an acute bout of back pain, but the reality is that prolonged bed rest can actually curtail your progression and can potentially worsen the symptoms. Movement and exercise, when done appropriately, can be beneficial at alleviating your pain, but it's one of the best consistent methods to actually provide a healthy environment for a state of healing.
Boom! You blow my mind, M-Dog. Well, hit me with some more knowledge. Isn't it true that when my back is killing me, I've got an injury? I mean, I got to go get that MRI, right?
Yeah, it's true that at times a actual tissue issue or an injury to the area of the lower back can actually create pain, but this isn't always the case, and we can't overlook other factors that can actually elicit lower back pain, like postural intolerances. This could be intolerances to daily life stressors and or occupational demands, being overweight or obese, as well as the lack of exercise. Psychological factors like stress, anxiety, and depression greatly contribute to lower back pain. The presence of being a smoker or heavy alcohol consumption, poor sleep habits, as well as poor nutritional and hydration habits greatly influence lower back pain, as well as potential illness.
Now, I know this has got to be true. If my back is broken, don't I have to go get it cut open, put all those pieces back together, sew me up like a scarecrow? I mean, isn't surgery in my future?
Yeah, the truth behind surgery, depending on what source that you read, is only between 2 to 6% of chronic back pain patients actually ever have to encounter a surgical intervention to help alleviate symptoms. So while it's oftentimes referred to as a last resort in the treatment of lower back pain and performed only when other non-surgical treatments have failed, it is important to also note that there are some signs and symptoms that dramatically increase one's need for surgical intervention, and there are a few rare emergency type situations where you will have to undergo some type of surgical intervention. But the answers to those questions lie best answered with a consult with your neurosurgeon.
Well, I'm not so much worried about degenerative disc disease. I mean, I'm only 24 years old, and we all know that degenerative disc disease is an old geezer's diseasers. So hit me with some more truth serum. Every time I go to the doctor's office, I get told that I've got arthritis, that I've got degenerative disc disease, and that this is just part of getting old. I mean, I need to be focusing on all that anti-aging stuff or just stop getting older, right?
Yeah, it's a major myth that degenerative disc disease only affects older people. The truth is that degenerative changes of the spine can occur as early as our 20s or early 30s. This is brought on by a lot of lifestyle choices as well as comorbidities and potential genetic factors. And along that same subject matter, I'm oftentimes reminding people in their 30s or early 40s that the period between 45 to 55 actually shows us an exponential rise in disc-related problems. This is for a lot of reasons outside of the scope of this video, but if you have knowledge that your risk of a disc issue is exponentially higher between the ages of 45 and 55, maybe in your 30s or early 40s, you can help set up a healthy environment to reduce those risks. So that's a great point to keep in mind and one I'm constantly educating people on in the facility.
All right. I've got it. This is the one that's going to stump you. There's no way that this is not the truth. I've got 2 words for you: pain pills.
The inevitable question about pain medications. Yeah, I think in America, our reality is that pain medications, both over-the-counter as well as prescriptive, have become a first-line defense against lower back pain. However, when you look around the globe, you actually find many nations do not utilize that approach at all, or they highly restrict it. So I think we have a little bit of a skewed mentality when it comes to the use of pain medications. It can be effective, but it is not the consistently reported best approach at actually mitigating lower back pain in the literature.
Now, I need you to convince me of this otherwise. I've got degenerative disc disease, and therefore ultimately I'm going to be disabled, which is why I'm looking for a facility that will give me a functional capacity evaluation so I can get a 10% disability for the rest of my remaining work years.
Now, if you believed the myth that degenerative disc disease will ultimately lead to disability, you would be ignoring the truths that I've already stated. Despite the fact that essentially all of us will develop these changes over the course of our lifetime, a small percentage of us will actually develop chronic pain, and of that population, an even smaller percentage will actually incur disability as a result of those symptoms. So it's really critical that we acknowledge the fact that with an active, healthy lifestyle, we will develop these degenerative changes, but still be completely asymptomatic.
When I was an all-state football player for scoring 9 touchdowns in 1 quarter, I could deadlift a 57 Chevy, I could squat the entire women's basketball team, and I could bench press Andre the Giant. I was truly a man amongst boys. Now, with that said, this is what's got me into this predicament. There's no way I can exercise at this point having degenerative disc disease, because that's just going to break me down so much faster and it's going to cripple me.
Yeah, that myth is probably the granddaddy of them all, something I hear time and time again and could not be any further from the truth. The idea and notion that exercise can be harmful for people with degenerative disc disease is completely false. Exercise time and time again, study after study, decade after decade, has been consistently proven in the literature to be one of the fundamental factors that needs to be included in the treatment of degenerative changes of the spine. Strengthening and endurance of the trunk musculature not only helps to provide support and allow for adequate mobility, but it helps with our overall fitness and our weight management, as well as mitigating the potential to have a slew of our most common comorbidities. Hope you guys found the information useful. I want to thank Metal Mike for coming on board. He boldly asked the questions where many of us never go. I know that you, our viewers, have asked many of these questions silently in forums, and I hope that I summarized some of these most common questions for you and kind of took some of the fear out in knowing that there are strategies to implement physicality into your lifestyle to help mitigate some of your symptoms associated with degenerative changes of the spine. Any comments that you have, questions, post those down below. Smash this like button. Subscribe to our channel if you haven't already done so. Go out and have yourself a wonderful day. We'll talk to you guys soon.